Lesson 3 covers patient transfer and body mechanics, skills that protect your patients from injury and protect your career from musculoskeletal damage. The ARRT tests safe handling, transfer techniques, and fall prevention. Let's get into it. 5 transfer methods you need to know. Ambulatory transfer. Patient walks with assistance. Always use a gait belt. Never let go until the patient is seated or secured. Wheelchair transfer. Lock the brakes first. Every time. Before any transfer begins. Draw sheet transfer. Slides the patient laterally across surfaces. Minimum 2 staff members. Coordinate movement allowed. Count together. Transfer board. Bridges the gap between surfaces for patients who can partially assist. And 3-person carry for fully dependent patients. Count aloud to coordinate. Never attempt a dependent transfer alone. Lock the brakes. Then transfer. That sequence never changes. Body mechanics protect your spine on every single shift. 4 rules that apply to every lift, every assist, every transfer. Wide base of support, feet shoulder width apart. Stability starts from the ground up. Bend at the hips and knees, never at the waist. Bending from the waist multiplies the load on your lumbar discs dramatically. Keep the load as close to your body as possible. Distance from the body equals force on the spine. The further away, the worse. And never twist while loaded. Pivot your entire body by moving your feet. Twisting under load is the most common cause of acute back injury in imaging departments. Know your fall risk factors. Age over 65. History of prior falls. Altered mental status. Sedatives or diuretics. Use of a cane, walker, or other assistive device. When risk is elevated, never leave that patient alone on the table. Use side rails when available. Maintain verbal contact throughout the exam. Have a spotter during upright projections. If a patient starts to fall, do not try to catch them completely. That risks injury to you both. Instead, guide them slowly and controlled to the floor. Protect the head. Call for help immediately. Use your tools. Sponges, sandbags, Velcro straps, and compression bands exist, so you don't have to manually hold patient parts during an exam. Using them reduces patient dose from repeat exposures and reduces your ergonomic strain. Adjust the imaging table to hip height before transfers. This eliminates the bent-over position that causes cumulative back damage over a career. Step away from the tube during every exposure, especially during C-arm and fluoroscopy work. Alternate between physically demanding and lighter tasks throughout your shift. Cumulative musculoskeletal injury over a career is real, and it is preventable. Pediatric patients use age-appropriate immobilization devices rather than manual restraint. This protects both the child and the radiographer. Bariatric patients use bariatric-rated equipment. Know your facility's policies and team lift protocols before you need them. Post-surgical patients check for drainage tubes, IV lines, catheters, and surgical wounds before any repositioning. Move nothing until you have confirmed clearance. And combative or confused patients, never restrain without authorization. Use verbal de-escalation first, get assistance, and document the situation completely. 3 transfer and body mechanics questions. Think first. The answer is A. Lock the wheelchair brakes. This is always the very first step before any transfer. A rolling wheelchair during transfer is the most common cause of transfer-related patient falls in imaging departments. Lock the brakes, confirm they are secure, then proceed. The answer is B. Bend at the hips and knees, keeping the load close to the body. Bending at the waist, twisting the spine, or keeping the feet together multiply the force on your lumbar discs dramatically. These errors cause the majority of occupational back injuries in radiography. The answer is C. Guide the patient slowly and controlled to the floor. Attempting to fully arrest a fall puts you both at risk of injury. The safe technique is controlled descent. Protect the head. Get them to the floor safely. Then call for assistance. Document everything. Strong transfer technique and body mechanics protect your patients today and your spine over a full career. Head to the practice section and keep drilling.